learned will be delivered during this time. Thank you for the faculties, patrons, delegates, each and every one of you. There have been overwhelming response and make the best utilization of this session, which is going to be different. There's no didactic lecture. Nobody going to keep talking, and put you to sleep. And sometimes you may be woken up, and ask questions. And there are some areas where you can ask questions. You can ask questions as well as you can reply some answers. You'll get a gift. So please be awake. One important thing I would like to tell you is not necessarily all the time going to be in English. There are people who can, Vinci is here, and who can interpret in Tamil as well as Malayalam. And you're welcome to utilize any language. Our girls and boys have put in excellent work under WD, and thank you very much for coming. And Vinci, all yours.
What a beautiful morning, dear ladies and gentlemen. My name is Vinci Michael, and I'm going to be the host for this wonderful session. And I take the privilege to welcome each one of you on behalf of Ortho-One Academy. Welcomes you all to the inaugural ceremony of the Athletic Knee and the launch of HSI in collaboration with Sports Science India and Abhinav Bindra Targeting Performance. So this is going to happen after 11. So now we are going to start with the session. Before that, I know this hall is filled with all the wonderful athletes, achievers, doctors, faculties, and wow. And of course, there are a few wonderful fathers. Today has been Father's Day, and I take the privilege to wish everybody a very happy Father's Day. And ladies and gentlemen, let's give a big hand of applause, and let's bring the positive energy into this hall, for I believe this is going to be a wonderful session today. So thank you so much for making this morning so bright and beautiful with your presence. So the first session of the day is going to be athletic knee running analysis. I would like to invite the moderator along with the speakers as I call the names. First, I would like to cordially invite Dr. M. Shyam Sundar, shoulder and elbow surgeon, Ortho-One Orthopedic Center, specialized in sports medicine, arthroscopy and joint replacement, academic and research director, Ortho-One Orthopedic Center. Ladies and gentlemen, please give a big hand of applause. Thank you, Doctor. Thank you for being with us. Followed by Dr. Shyam Sundar, I'd like to invite Dr. R. Nadrajan, IRS, Deputy Commissioner of Customs, GST, DGPM, SRU, Olympic Qualifier, International Amateur Athletic Federations, LT Coach and L1 Lecturer, South Asia's fastest man title holder for the year 1988 to 1991. Ladies and gentlemen, please. Thank you, sir. Thank you so much for being with us this morning. I would also like to call Mr. P. Rajani Kumar, Assistant Professor in Tamil Nadu Physical Education and Sports University, Researcher and Head of Center of Excellence for Biomechanics cum High Performance, Hockey, India Level 1 Certified Coach. Thank you, sir. Thank you so much for being with us. Ms. Nabila Nars S., co-founder of SWAT Kids, Sports Biomechanics, SAI, Specialty Motor Skill Assessment, Human Motion Analysis. Thank you, ma'am. Thank you for being with us. I would also like to welcome Mr. Kannan K., who is also well known as Coach K, Certified Project Manager and Personal Trainer, Race Director, Ultra Marathons, founder of K's Fit Academy. Thank you, sir. Thank you for being with us this morning. I also like to invite Mr. Avinash, Cricket Coach, BCCI Level 2 Certified Coach, Tamil Nadu Ranji Trophy Fielding Coach, Head Coach, Tamil Nadu A Team, Chepak Super Gillies, TNPL Team. Let's give a big hand of applause and welcome him. I'll try, I think he will join us shortly. Thank you. I also like to invite Mr. Tamarinian Manivanan Athletic Coach, World Athletic Level 2 coach, health and fitness instructor, won national 400 meters. Thank you, sir. Thank you for being with us. Next, I'd like to invite Dr. Santosh Sahanand, Clinical Director, Ortho-One Orthopedic Center, past President of Indian Cartilage Society, Secretary of Tamil Nadu Arthroscopic Society, Section Editor, Journal of Arthroscopic Surgery and Indian Sports Medicine, Fellow member ICS and Joint Preservation Society. Thank you, sir. Thank you so much for being with us this morning. I would like to invite Mr. Divya Prakash, Sports Physiotherapist, Sports Science India, Abhinav Bindra Sports Medicine and Research Institute, Masters in Physiotherapy. He will also join us shortly. I would like to invite Mr. Amit. He'll be giving us an online session. Mr. Amit Bengulkar, Assistant SNC Coach, Lucknow Super Giants, former Strength and Conditioning Coach, Prakash Padukone Badminton Academy, Physical Performance Coach, Western Australian Cricket Association, Perth, Australia. I would also like to invite Mr. Nikhil Latte, Director, Physiotherapist and Sports Scientist, Pro Physio and Eye Performance Lab, Mumbai, personal physio for Indian Olympians like Saina Nehwal, Mary Kom and Gagan Narang. Let's give a big hand of applause, for we have all these wonderful moderators and speakers with us to give the session. I request Dr. M. Shamsundar to please take over. Thank you, sir. Thank you, Doctor.
Thank you, Vinci. Presentation board. Presentation. Very good morning. Good warm Sunday. Lot to learn. But let me make my presentation quite very simple. It's going to be a kindergarten presentation so that you understand the basics properly. That's when the experts explain to you, it will be more easily understandable. Okay? Now, the few terminologies which are very important for running is, I'll be talking under the same headings. What is cadence? What is striding? What is understriding, normal striding, overstriding? What are the most important types of foot landing when you're trying to run? And what are the most dangerous and safest foot angles that you're going to talk about in runners? What is a zone, safe zone for running for different type of runners? And what are the most important metabolism that a runner goes through when he's running? Now we have three types of runners. One is casual joggers, then you have long distance marathon runners, and you have sprinters. So their metabolism is totally different, their style is totally different, and we need to understand each and everything properly to get the maximum efficiency from them. Cadence is nothing but the number of steps per minute. For a jogger, it's small. For a marathon runner, it's little long. Whereas for a sprinter, he takes maximum number of steps, tries to get the thrust as much as possible. So this is very important, and it varies according to the style. And striding, you need to make sure when you're running, your foot or the heel strikes exactly below your hip. Understriding is where you take too many steps. Don't do that. You're going to strain yourself a lot, and you're going to waste your heart metabolism. You're going to increase or strain your heart rate. Same way, this is called understriding. And overstriding is when you stretch a lot, and you see the foot is striking the ground in front of the hip, not below the hip. So that's understriding, and this is a normal stride you have to maintain when you're running, let it be a long distance running or a sprinting. This is the most important thing. What are the type of foot landing? Now, for a forefoot landing, which is commonly seen in sprinters, and midfoot landing is commonly seen in marathon runners, that are long distance runners, and hindfoot landing is seen in joggers.
Striker. Gosh, she
That's
really runs on her
forefoot,
toes. Oh, that's
and then you have the
perfect.
midfoot landing.
Midfoot
All right?
strike. You've heard the terms.
I'll be playing it once again.
Heel
You have the
striker.
hindfoot
Gosh,
landing,
she really runs on her
forefoot
toes.
landing,
Oh, that's
and then the
perfect.
midfoot landing.
strike.
Right? This
You've
is
heard
very
the terms
important to
though.
do the biomechanical analysis of the foot.
Own run-
Take a closer look at it, not just Usain Bolt, all the sprinters. In slow motion, where are they landing? It's just the forefoot, and that's the one which gives the maximum thrust. And how much is the follow through? Once the foot lands on the ground, it reaches up to their buttock, and that's a swing that they get, and that's the one which gives the thrust and the momentum to propel further. This is very crucial for a fast or a sprinter. Now the same thing, why is Usain Bolt so special and different from others? Because all the sprinters are taking the same steps. Their cadence is the same. All right, their foot strike, everything is same. But why is Usain Bolt different? If you take a keen look at his stance and his thrust the moment he gets from the bullet strikes, he takes beautiful steps, and at the same time, the number of steps he takes and the kind of propulsion that he gets with each step is much better and advantageous than the others, and you will see it right now. Don't take a look at Usain Bolt, look at the second runner. He is running at the same pace, but with each step, Usain Bolt gets more thrust, which means biomechanically and stature-wise, he is at an advantageous position. So that's the reason why he is getting thrust in each and every step. All right. So everyone has got the great steps, cadence, whatever it is, but the thrust, Usain Bolt is little advantageous. All right. The midfoot landing is classically seen in long distance runners. It can be 20K, 40K or 10K, and it is always safer to absorb the load in your ankle joint. Hindfoot landing, mainly for joggers. No? The hindfoot landing, you can just do easy jogging, and it, of course, the heel absorbs the pressure, but you have enough time to recover, which means it does not lead to any injury. That is very, very important. But you can't do hindfoot landing in a sprinter or a long distance runner. So these are the types of hindfoot the foot landing seen in running. Next is very, very important. Keep a note, which is the safest foot rotation when you're trying to run.
So rotation in the foot changes this angle. And here is what we call pronation.
When the foot moves
While
outwards,
this
it's
is
pronation. When it moves
supination.
inwards, it's
If our
supination.
foot creates this angle after the landing and rotation, we runners call it neutral pronation. This angle is over pronation, while this is under pronation. Congrats again.
So, when a runner has overpronation, he is more prone for foot injuries. When he maintains it in neutral rotation, it is always safer. So make sure that your athlete has a neutral rotation when he is running or landing the foot. Now, this is very
muscle
important.
groups
Supination
again
landing.
and again and again in
This
a
is
perfect
relatively
sequence.
safe
It's something that takes years.
When the
to
athlete
practice
lands on the
and
outer
get
border of the foot. See, when he lands, the outer border of the foot is the one which contacts the ground.
muscle groups again
Take a look at
and
the
again and
foot
again
which
in
is
a perfect
contacting.
sequence is something that takes
The outer
years
border
to
contacts
practice
first and then the
get
inner
right.
border. This is supination landing. All right. This is neutral landing. The entire forefoot hits the ground at the same time. That is neutral landing. This is the safest landing that you can get in running. It's always safer. And then let's go to the master. The world record holder, Eliud Kipchoge. I'm sure you would be aware of this video. He is something special, all right? Take a look at his foot landing. That's pronation, all right? This sort of pronation may be normal for Eliud Kipchoge, but it cannot be normal for others, all right? So make sure you do not land in this posture, in this rotation, because Kipchoge may survive because he's got a good team to recover, but we cannot, okay? So you have to be very careful not to get this sort of a foot rotation. Now, what is the best zone for running, all right? The zones are very, very different, and first thing is you need to calculate what is your maximum heart rate. Your maximum heart rate is 220 minus your current age. Say, for example, you're 40 years. Your maximum heart rate that is allowed is 180 beats per minute. That's it, all right? So what happened was, I'm 39. When I started running, my iWatch gave me an intimation. Your heart rate is 187, please stop running. I stopped it. Had I continued, I would not be here. So always make sure you do not exceed the maximum heart rate. The best heart rate for long distance runner is zone 2, which means you need to maintain your heart rate at 60 to 70% of your maximum heart rate, which is around 126. And the best heart rate for a sprinter is zone 5, where you maximum use all the potentials within the 10 seconds that is given to you. So for a sprinter or a fast runner, it's zone 5. And for a long distance runner, you have to maintain at zone 2. This is very, very important. And if you're trying to aim for long distance running, bring your heart rate to zone 2. Don't let it go to zone 4 or zone 5. All right? What is the metabolism? This is the last. Okay? Now, there are two types of metabolism. One is aerobic metabolism, and another is anaerobic metabolism. Aerobic metabolism is use your oxygen, which means you have good heart rate and you're able to use as much oxygen that is present, and you sweat. When you sweat, aerobic metabolism is kicking in and you're burning your body fat. Okay, your body fat burns, you sweat, you use the oxygen. That is during the initial phase of running. For example, if you're a long distance runner, the initial 3 to 5 minutes you sweat, and that is aerobic metabolism. Now, anaerobic metabolism is when you exceed more than 15 or 30 minutes, then what happens, there is lack of oxygen. So what does the body do? It takes out the carbohydrates from your body, and that's where the lactic acid builds up. So carbohydrate provides energy, lactic acid deposition happens in the muscle, and that is the main reason why you undergo fatigue and you experience pain in your joints. So the threshold, the very good threshold for a long distance runner is aerobic threshold, which means a long distance runner uses his body fat and there is no lactate buildup and he can run for how much ever distance he wants. Lactate threshold is where the accumulation happens. That typically happens in a half marathon pace, and when you slightly tend to find or you feel the pain in your muscles, that means, okay, fine, your body is deprived of energy, you have to be a little cautious. And anaerobic threshold is where there is complete buildup of lactic acid, and it's a warning sign, which means you have just limited time or distance to cover. So these are the basic things about running, after which we have the experts who will be explaining to us about the different types, and then we'll have the question answer session. Thank you. I request Dr. Rajinikanth Palniappan to start his presentation. Comments. Okay. Yeah. Yeah. Okay, fine, perfect. I'll play through the next slides. So I'll be playing through the next slides of Dr. Rajinikumar Palniappan, and if you have any comments, you can pitch in and do it, sir. All right? You can talk, carry on.
Yeah. So we can categorize the movement into 4: jogging, walking, jogging, running, and sprinting. So what differentiates is the amount of force or speed differentiate, and the speed of running differentiate the walking, jogging, running, and sprinting. But the structure decides function and function decides structure. So in this case, the injury possibilities are when there is more force. The second one is the technique. Even if you are not applying much amount of force, maybe slow jogging with poor mechanics may lead to injury. And the muscles which are not balanced. Shall we go to the next slide? So in the real time, what we measure is the ground reaction force, because the whole body in contact with the ground, and the force is acting in three directions, that is X, Y, Z. So normally the strength and conditioning population and coaches, they observe only the reaction force, that is Z force. But the most ignored part is, that is X, mediolateral force, because as doctor said, the foot is going from supination to pronation, from heel strike to forefoot contact during walking. In the case of midfoot or forefoot contact, so there is a supination to pronation movement happens. So the mediolateral force is, right, the assessment of mediolateral force is essential. Apart from this, in the case of running, the athletes apply not only the vertical force, also the anterior-posterior force. So anterior-posterior force is 1/3 of the force what the athletes apply with regard to vertical. Next, please. So we use force plates to measure. So this is a graph which says this normal running pattern. This is the graph, and you can see the amount of force applied here. It is when you are going for normal running, it is 3 times the body weight, right? That is occurring in your joints. Is the reaction force. Next, please. So when you are contacting with the ground, that is impact peak. The impact peak should be lesser than the active peak. So impact peak is nothing but the moment you contact the ground first during running. So during propulsion, the force must be right higher. So by seeing this graph, we can come to understand, okay, he is having normal, proper form of running. And when the impact peak is higher than the propulsive peak, obviously he is in poor mechanics. Maybe we can term him as heel striker. Next, please. So this is overstriding. You can see in this graph. So by seeing the graph itself, we can come to understand what type of mechanics he has or foot contact he has. Next, please. So this is understriding, and you can see in the green graph, which shows the data of understriding. Next. So sometimes we may use a sophisticated equipment, and when we don't measure with ideal technique, and we may get half-boiled data. So this is how, when the athlete is not having contact, full contact with the force plate, half contact with the force plate, obviously this is the half-baked data. And you can see the different graphs showing running fast, slow, and walking data. Next. Yes. So this is about footwear on ground reaction force. When you run with barefoot and when you run with shoe. So barefoot, when you run with barefoot, the impact force is more on your joints. When you wear shoe and run, the impact force is minimized. Next. So when it comes to running analysis, the muscle asymmetry or the muscle symmetry is essential. So sometimes we measure with regard to real-time assessment, and sometimes we measure with sophisticated equipment for estimating the forces. So this is isokinetic dynamometer, what we have in our lab. And we measured about more than 500 athletes with regard to HQ ratio, hamstrings quadriceps ratio. And they are all top athletes who came to our lab. Next, please. So this is instrumented starting block. It will tell you how much amount of force you apply in each block, and what is the reaction time, and what is your impulse, and which is your dominant leg. So those parameters we can find out. So with regard to jump, so jump is totally different from running. So in jump, more focus is on vertical, completely vertical. Next. So apart from these, we also individualized muscles activation pattern, or the electrical activity of the muscles can be measured with the help of EMG. And particularly when we run, so the gastrocnemius medial and lateral, as well as VMO, that is vastus medius oblique activation pattern, can be found out in each and every sequence of running, phase of running. Next, please. So before this, I would like to say that the asymmetry was found. For an example, it is 3:5 is the ratio which when it comes to HQ ratio. So when we assessed more than 300 athletes in our lab from different sports, we found that they were having less than 50%. Less than 50% what the quadriceps peak force they have. So this is what I would like to say. So this is a small video of our lab, because Tamil Nadu Sports University is is blessed with South Asia's biggest sports biomechanics lab. You can just see this for your the support of sports science.
Today we are in this beautiful facility of Tamil Nadu Physical Education and Sports University, where Qualisys in collaboration with government had set up this state-of-the-art biomechanics lab.
This laboratory was conceived in 2015. After a long journey, we got the grant from Tamil Nadu Planning Commission, and we established this South Asia's biggest sports biomechanics laboratory with an area of 21,000 square feet. And this lab serves with triad model: academics, research, and consultancy and support services to the athletes and for the different sports fraternity.
This is first of its kind facility in India for research and evaluation of sports biomechanics in cricket, hockey, tennis and many other sports.
Tennis, we have an exclusive setup where we measure the tennis service in each phase like ball toss, racket acceleration and ball contact and follow through, and give inputs to the coaches as well as the athletes.
My first introduction to this lab was during my masters, as I was involved in the floor plan design as well as the 3D modeling of this lab. My research area focuses on muscle tendon profiling, impact of female athletic triad among young athletes, and assessment for strength and conditioning. I have found the system to be more user-friendly because of its seamless integration, and especially the functional assessment module. It helped me to assess a lot of people in a short period of time.
Qualisys provides a portable solution for both indoor and outdoor applications, giving a high level of accuracy and precision.
So with this motion capture system, we kinematically assess the athletes by incorporating all the key performance indicators, which will give an insight to the coaches and athletes for the enhancement of the performance with remedial measures.
We have an external biomechanics setup for boxing to quantify the key performance indicator using Qualisys and 3D mocap integrated with the Kistler force plate and Delzis EMG. The Qualisys system helps me to quantify the punch velocity, and force plate reveals punch force and down reaction force of the feet. Further, it helped me to correct my techniques in different types of punches and then improve my overall boxing performance.
Whenever we encounter any issues, it is easily addressed by the team. That's why we feel very comfortable in using Qualisys. The vision of the lab is to produce more sports science professionals with skills and educating the coaches with regard to the usage of the sports biomechanics, and finally to produce medal winners in 2028 and 2032 Olympics and ahead.
Thank you. Thank you very much, sir. We will proceed to the next talk by Nabila Nas on biomechanics of running the muscles.
Okay. All right. So I already, because two of our speakers have finished, there's been a basic understanding of what running is. I was told to cover the topic of muscles. So I'll just take it from the scratch and then talk about the muscles. First, so I'll also be talking in Tamil. So if anyone has anything to add, please, you can add whenever you want. So when we talk about the phases of running, very simple. There is a swing phase, there is a stance phase, right? So stance phase is basically when the foot is in contact with the ground, and swing phase will be when the foot is off the ground. So from here till here, this will be the swing phase or the flight phase, and the moment you touch the ground till you leave, that would be the stance phase or the support phase, right? So that is very simple. Now if you go forward, can you just go forward? Yeah. இப்போ ரெண்டு ஃபேஸஸ் இருக்குல்ல, ஒன்று வந்து ஸ்டான்ஸ் ஃபேஸ், இன்னொன்று பார்த்தீங்கன்னா ஸ்விங் ஃபேஸ், சரிங்களா? நான் சொன்ன மாதிரி ஃபுல்லாக நீங்கள் காண்டாக்டில் இருந்தீங்கன்னா அது வந்து ஸ்டான்ஸ் ஃபேஸ். வென் யூ லீவ் த கிரவுண்ட் நீங்கள் வந்து ஸ்விங் ஃபேஸில் இருக்கீங்க, ஃப்ளைட் ஃபேஸ், சரிங்களா? லெட்ஸ் மூவ் ஃபார்வர்ட். ஓகே, இப்போ நான் ஃப்ளைட் ஃபேஸ் பற்றி ஃபஸ்ட்டு பேசலாம். ஃப்ளைட் ஃபேஸில் வந்து வெரி சிம்பிள். ஒரு விஷயம் என்னென்னா, உங்களோட ஆங்கிள் இஸ் நாட், ஐ மீன் தெர் இஸ் நோ muscle activation or any active involvement of ankle in flight phase, right? It is completely the hip and the knee that is, the muscle action is coming primarily from the hip and the knee. So I'm going to talk about that. So this is the early flight phase. If a flight phase le pathina, in flight phase you have three sub phases. There is early flight, there is mid flight, and there is late flight. Early flight is the moment you leave the ground, right? And then you are approaching the mid-flight phase. From here to here is early flight. This is mid-flight, right? From here to here, when you are approaching the late flight phase. And this is your late flight phase, right? So this is the division. I'm talking about the early flight phase here. And look at the left leg. You have to look at the left leg here, not the right one. So it is leaving the ground, and the moment from here to here is what we are talking. So if you look at the hip, what is the movement that is happening in the hip? Very simple. So it is going in extension, right? There is extension, controlled hip extension. So there is eccentric and concentric muscle activation that you need to understand. Concentric is muscle shortening under tension. Eccentric it is lengthening under tension. That is it. So shortening under tension and lengthening under tension, right? So if you look at this, there is, what is the movement happening in knee is basically knee is also going into, from here to here, it is going into flexion, right? So what is the muscle the muscle action over here is going to be eccentric knee extension, not concentric knee flexion. It is eccentrically controlling. So the muscles that are activated here would be the knee extensors, which are eccentrically functioning or activating, right? So there is a very, why we are talking about all of this is, if you don't understand what is the action of the muscle in each of the phase, then you will not be able to train them or give them rehab appropriately or design a strength training program for them. So this is the early flight phase. The important thing to notice here is there is a concentric hip flexion. The movement in hip is flexion, and there is a concentric hip flexion. What is a hip flexor? Iliopsoas, right? So iliopsoas is iliopsoas is not activating here. The main thing is eccentric hip flexion, right? So iliopsoas is eccentrically controlling the movement. And over here, knee extension, eccentric motion. So the knee extensors are eccentrically controlling the motion. So in this phase, like the early flight phase, there is no concentric action. There's only eccentric action of hip and knee. Eccentric movement agudhu. So if you don't have the eccentric strength for it, then you will not be able to do it properly. Then you will have a problem, okay? So the eccentric strength is very important in the early flight phase. Now in the mid-flight, if you look at it, there is a concentric hip flexion movement happening and eccentric knee extension, right? So what does that mean? For forward acceleration of thigh, you need a concentric movement, and there is, so forward acceleration of thigh. Can you go a little bit back? Yeah. Eccentric knee extension to control the knee flexion, right? So if you look at this, what is the movement happening here? It is going for knee flexion. From here to here, knee is flexing, right? But the muscle activation, again, like I said before, eccentric knee extension is the muscle action here, not concentric knee flexion, okay? Let's move forward. In mid-flight itself, what happens is, from here to here, the knee action changes from this phase to this phase, and from this phase onwards to this phase, right? So this is the second part of mid-flight, same mid-flight. In here, what happens is the same thing in hip, but only variation happens in the knee joint, wherein eccentric knee flexion happens towards the later part of your mid-flight phase, just before you enter the late flight, right? So this is the late flight. In here again, what happens in late flight is the hip is going in flexion and the knee is preparing to extend, right? This is a very important phase, because over here, if your hamstrings are not strong enough, then you can land up into a lot of several injuries. We have many people who have experienced who have practiced running and experienced injuries themselves. When they talk about it, you will understand it better. But if you do not have a strong hamstring, especially in the late flight and the early support phase, is where you get injured, okay? That is how much hamstrings are very important, right? So, and let's move on to stance phase. I am just simply dividing it into early stance and late stance, very simple. In early stance, if you look at it, so yeah, again, we can take the left leg here as the reference. Early stance is from here to here, right? When the whole body is, the whole body weight is going through your lower leg. From this point to this point would be the early stance, right? So if you look at this, the main thing here is observing the force that has been created in the flight phase, right? So for that, you need the eccentric activation of the hip flexors. So if the iliopsoas is not activated and is not controlling the movement, then you will land up in injuries. So hamstrings followed by iliopsoas. When you land, hamstrings are equally very important as well as the iliopsoas. If they are not activating and controlling your movement, you will overstride. There's a lot of things that sir has also mentioned, overstride, and your pattern is not going to be right. Ungaloda and the pattern மாறிடும். So the important thing is late flight as well as early stance. I am very specific about this because இதில் தான் நிறைய இன்ஜுரிஸ் வரும். இந்த ஃபேஸஸில் தான் பார்த்தீங்கன்னா நிறைய இன்ஜுரிஸ் வரும். Because your hip flexors are not functioning properly or are weak, or the hamstrings are not, strong enough. Okay, let's move forward. Yeah, in this phase, the ankle is also very, very important. In flight phase, ankle has not that much of a role, but when it comes to support phase, ankle is actively, going into plantar flexion, there is an eccentric motion followed by concentric motion of your calf muscles, gastrocnemius and soleus. So if there is no eccentric control, if your tibialis anterior is not strong enough, followed by your calf muscles which are not strong enough to give you the push off, then you will have trouble again, right? This phase, your tibialis anterior has to be strong enough to absorb the force or give you the control, and followed by which you need a strong calf muscles to give you the push. Seringla, that is the importance of all these muscles, and it is important for you to know whether there is a concentric motion happening in these muscles or eccentric motion happening in these muscles. Okay, let's move forward. All right, so if you talk about the different events, right? This 100-200 meter, if you look at it very straightforward, it has a very short stance phase followed by middle distance. The stance phase is a little longer, right? Then marathon la pathina stance phase is very long as compared to the flight phase. The flight phase reduces drastically. Okay, and look at the second point. There is a rapid transition from the early to late stance. Here there is a combination of midfoot to forefoot strikes, right? Here it is majorly midfoot strike. Here there can be a combination of midfoot and forefoot strike. Here, if you look at the marathon runners, right? They have to distribute the force equally, right? Sorry. So there is a more heels, you can observe a little bit of heel strike more as compared to the other events because they have to distribute the force equally. And finally, look at the last point. It's about the flight phase. Here, obviously, sprinters have longer flight phase, and in middle distance, it is moderate. It reduces as compared to the sprint. And finally, if you look at the marathoners, the flight phase is drastically lesser as compared to the sprinters. Seringla, that is the main difference. Let's move forward. Okay, so I have already given you an idea of muscles. Now when I talk about it, it will be easier for you to understand. So this is about 100 meters and 200 meters. Can we go back a bit?
Shall we make it quick?
Yeah. I'm just about to finish. Yeah, so just pause here. This is about the sprinters, right? So early stance, very simple. Your quadriceps is the one which is absorbing the shock. Okay, that has the primary role. And when it comes to the hip muscles, glutes and hamstrings, again very, very important. So the primary thing here is knee la pathina quadriceps, hip la pathina gluteus and hamstrings. Seringla. Then late stance, obviously like I said, you need the calf muscles to push off, right? Calf muscles and hamstrings and gluteus to control the motion. Okay, and flight phase, if you look at the flight phase, iliopsoas, rectus femoris, your hip flexors are very, very important here to drive the knee forward. If they are not functioning, then knee will not drive forward properly. Hamstrings eccentric work is very, very important. In 400, 800 meters, it is pretty much the same. There is not much of a difference, but if you look at the early stance, there is a lot more strong activation of quadriceps and glutes. And the rest of the things are pretty much the same. Let's move to the next slide, which is the marathon long distance. In this, if you look at it, because of the energy that they have to conserve, all the muscles are activating, but not forcefully. It's about the endurance, right? So we all know what is the muscle fiber activation here. So for sprinters, it is the fast twitch fibers. And for long distance runners, it is going to be the slow twitch fibers. Okay, that is mainly the difference. So it is not forcefully producing the force, it is generating the force but not at a forceful manner because it has to conserve the energy. Yeah, so this is just a slide of just showing where these muscles are. For the first phase, it's the gluteus, hamstrings, which are very important. For the second phase, it's the calf muscles, which are very important for you to push off. And yeah, in tibialis anterior for you to control the movement. And for the flight, iliopsoas is very important. Hamstrings are very important. And yes, like I said, hip flexors for you to bring your knee forward. Yeah, that would be it. I hope that was clear. Thank you so much.
Thank you very much, Nabila. As this was a basic talk which we all have to understand, we've given so much time. So rest of the speakers will not have so much time.
We have a question for the audience. Audience, okay? Just raise your hands and we'll give you the mic. You can answer. What type of foot strike is injurious to runners? Raise your hands. We'll give you the mic. Then you can answer. Okay, that girl over there in the middle. Please get up. Please get up. Okay, mic கொடுங்க அவங்க கிட்ட. Standing mic இருக்கு. அங்க வந்து பேசுங்க வந்து.
Oh, it would be pronation.
Okay, why?
So when the type of running, when the foot can go into supination and there is neutral position and there is pronation.
Good.
In pronation, there is a lot of effort put to land in the middle.
Correct.
So it would be injurious for the runners to run in pronation.
Correct. The foot lands and all the stress of your body goes onto the ankle in a pronated manner, so strains your medial arch. So that is very much injurious to your medial supporters. So that will cause a lot of injury. So pronation or overpronation is injurious to runners. Thank you very much. Thank you. What is your name?
I'm Abhirami Vetrive.
Abhirami. Yeah. Please note it down.
എക്സ്ക്യൂസ് മീ, ഇവിടെ ഒരുപാട് കേരളൈറ്റ്സ് ഉണ്ട്. സോ മലയാളത്തിൽ ചോദ്യം ചോദിക്കുന്നവർക്കും ചോദിക്കാം, തമിഴിൽ ചോദ്യം ചോദിക്കുന്നവർക്കും ചോദിക്കാം. ഇറ്റ് വിൽ ബി ട്രാൻസ്ലേറ്റഡ്. താങ്ക് യു.
Okay, you can hand over the t-shirt to the winner. Thank you.
உங்க கேள்விகளை நீங்க தமிழ்ல கூட கேட்கலாம், ஆன்சர்ஸும் நீங்க தமிழ்ல கொடுக்கலாம், அதுக்கும் டிரான்ஸ்லேட் பண்ணப்படும். Thank you.
We'll go to the next presentation.
Yeah, good morning, honorable present here. It's going to be a simple presentation where everyone can understand. It's not going to be a typical biomechanism. Things will not happen in my presentation. So we work on the. My presentation is based on the how to work the athletes properly and release the from the starting blocks. So the first major thing is you want to be very warmed up. The athletes should be warmed up because the sprinters are very easily fond of hamstring injuries and calf muscle injuries. So please be warmed up very properly. The next slide. It's the next one. So setting up the starting block, it's very simple. That from the starting line, you just want to make a simple 1 foot measurement, and you can keep your starting block. And after keeping the starting block, you can ask your athletes to stand there and visualization on the run and the start and for the gunners, the starters gun. So next one. So as I said, the block should be here. It will allow you to set the distance from the 1 foot from the starting line, so that the runners must be established with this power leg and lead leg. It's very simple to find out the athlete's power leg and the lead leg. The next slide. So finding out the power leg and the lead leg, it's very simple. So as coaches, we just want to go and talk with the athletes and stand behind him. If you gradually push your athletes forward, the leg which he carries the whole body weight, it considered as the power leg of the athletes, and the opposite leg can be done for the leading leg. Next. So once we find out the starting blocks, power leg and lead leg, the athletes, so we asked them, the athletes, to go to the starting block, and we asked, we trained them in a way where he runs very fast and release from the starting block once the gun fires one. For example, so the sprint outs, once the gun shots, the sprinter should be very quick from the blocks, and arm should be very clean and perfect on the length where he can run, and dual, he can kick up his glutes also. The next one. Once the gunner who says on your mark, the athlete should be very prepared, and he should be on the starting block. And then the hamstring and the calf muscle and the flexors, and it will work together for him. Next one. So set position, it's a very important position in the starting block. So the lead leg should be in the power leg should be in the 90 degree, and the lead legs can be in 130 degree. And the most important thing in the set position is your fingers should be only on the finger should be in the ground. And I always say my athletes to lean little forward, front, to carry their weight on the front, so that the glute and calf muscle and hamstring will be easy to fire when the gun is fired. Next one. So as I told, and I'll always told my athletes also, so imagine themselves as of taking off the flight takeoff. So the flight always takes from the 45 degrees, so that they can take off and they run very firm and fast to the this one. The simple thing is, once you release from the block, you should be very stable and take the momentum and speed for the first phase to the 20 to 30 meters of the drive, and gradually stand tall, and you can be very stand tall and activate your core, and you can swing your arms very clearly, so you can put up some momentum in your starting blocks from the drive force. Then you can try to keep the momentum till the finish line. And thank you.
So what we are trying to do is running lay on the different types of running இருக்கு. ஸ்ப்ரிண்ட் தான் இப்போ பார்த்துருக்கோம். இதே லாங் டிஸ்டன்ஸ்னால் என்ன ஆகும், அப்புறம் ஆன் ஃபீல்ட் ரன்னிங்னா என்ன ஆகுன்றத சொல்கிறதுக்கு தான் இப்போ மாறி மாறி பேசிகிட்டு இருக்காங்க. ஓவர் டு கோச் கே.
Good morning. All right. How many of you are runners here? How many of you run here? I see only a few hands. I thought everybody runs. As human beings, we are all supposed to run. How many of you marathoners? How many of you run one marathon, which is like 42.2 kilometers? All right, that's good. Anybody run an ultra marathon? Okay, we've got one, so I can probably include myself. See now,
you should ask how many of you ran to catch the bus.
that's a sprinters. I thought that session was over. All right, thank you very much for this opportunity, Ortho-One. I'm going to cover some endurance essentials, if we can quickly go to the next session. So we'll start with some basic understanding of what a marathon distance is. A marathon is about 42.195 kilometers. And then when we talk about ultra marathon, only crazy people do. In this room, we have two of this, which is a distance which is above 50 kilometers. And then it can be a long run. It can be as long as a 100-mile race or multiple hours of running, 24 hours, 12 hours, and 48 hours. And it can be like a ultra where the longest distance to cover is 555 kilometers. Okay. Now, if you really look at some of the races, terrain-wise, a marathon is run on the road pretty much. Ultra races are usually held in mountains or mountain terrains, or even trails where there are no roads. And sometimes even some of these adventure races where the ultra marathon happens, where you'll also have to swim in between, cross mountains, walk, hike, all those things are possible. So these are some of the popular world major marathons. In India, Tara Mumbai Marathon is quite a popular one, largest number of runners. But also if you look at ultra marathon races, UTMB is really popular in Europe. We have France, Italy, Switzerland. Western States is a 100-mile race in California. Badwater is really happens at scorching heat with 50 degrees centigrade, where your shoes can melt. You know, that's kind of temperature. Comrades Marathon happens in South Africa. I can take the pride and say that I've done this 2 times. I've finished. It's a 90-kilometer ultra marathon. Not about me. Let's focus about the. And then Spartathlon is Greece, about 250 kilometers of race. It's crazy. Of course, I'm the race director of OT Ultra, which happens in OT, 90 kilometers longest distance, Law Ultra. All right, so let's quickly understand the marathon, ultra marathon demands. I know all of your athletes, before you jump into sports, you need to really understand what it takes to become an athlete. Slightly complicated. Expecting an ultra marathon runner to speak about ultra marathon in 3 minutes is going to be complicated. I'll try to do some justice. We'll come to this red arrows a little later. You can see how complicated the event, even preparation for that. Let's start with the athlete's backgrounds, very important. Genetic makeup plays a big role, but believe it or not, a lot of athletes in India are growing. Recreational athletes, you can actually rediscover. You can find the athlete in you through proper training. That's why the sports science helps us. And then mind and attitude plays a very, very key role. Of course, it's true for every single sport that we talk about, but ultra marathons are long, so mind and attitude plays a big role. Training, nutrition, and then gear in terms of what shoes that you wear, what apparel that you wear, all those things matter. Not the fancy products we are talking about, we're talking about essential gear. And then of course, race-specific preparation is really important. If you want to be a mountain ultra runner, you have to be training in mountains. You can't train in flatland and expect you to perform in mountain races. And then of course, we have a lot of race day factors. So these are all athlete and training factors on the left side. The race day factors, it could be distance, the running condition, the terrain, the altitude, the weather condition, could be rain, it could be anything. Injury, fueling is, this is the only sport I like because you can eat a masala dosa and continue to run. Okay, so that's really amazing. Racing, pacing strategy is important, and the last one is really important, mental and psychological. The reason why I've highlighted some things in red is these are very specific to ultra running, which are long, arduous, tough, which demands physical and mental capacity. Can you go quick? All right, preparation, progression. Let's quickly see solid foundation is important, cardiovascular training, strength and conditioning, and we talked about a lot of zone-specific training that is really important. Let's quickly see. And the most important thing is awareness. You really need to know what you're getting into, right? And then mental toughness is really important. A lot of visualization techniques are important. Race-specific training and conditioning is really important. And of course, meditation, mindfulness, calming down is really important. I think am I crossing my line? All right, let's quickly go through. Let's quickly go. I think we have seen that first slide. Let's go to the last slide, please. So the most important thing is you need to believe that you can cover those distances. And then the goals need to be really important because training for a marathon is a multi-year project. I've seen a lot of runners rushing into things. I'll do a 10K, I'll do a half marathon, I'll do a full marathon, I'll do ultra marathon. Then they come to Ortho-One. Okay? With that, anyway, it's a good thing. We have sports medicine experts who will put them back on track. But if you're a mindful runner, you can always train properly. It's a lifelong journey, and then you can be really a good runner here. Thank you for the opportunity.
Amit was not able to be here today because of a family emergency, so he was kind enough to send us this video.
Hi guys, how you all doing? My name is Amit Venkurlikar, and today I'm going to talk a bit about running technique drills. Let's dive into it. This is now we talk about lateral running technique. Here the athletes now is leaned sideways with the elbow in a straight line with the shoulder, head pointing straight, nice good straight position again, head, shoulder, leg in a straight line. This leg might be slightly out, but still okay. And then keeping a nice neutral spine. So here the athlete is now pushing down from the outside leg, flexing the inner knee. The goal here is to push the ground down and away to improve that lateral movement. And see how he does his quick switch. So really driving down and out and flexing the knee. And then we build into some lateral movement on the court. When he starts, he's pushing on the side with the right leg. So that's exactly what he was doing on the wall. Now I've added some resistance up here with a loop band to give him a bit more intent of pushing through. And then he pushes this leg, he would extend this leg and he moves, takes 2 steps. Then once he gets to the other side, watch what he's trying to do now. He shifted his body weight to the left, and now he's going to push down with the left leg and get that force into the ground and come back to the center position. So the goal here, when we want the athlete to move to the left, we want the athlete to push to the right. So push the force into the opposite direction. That's what we want to do. Don't worry about moving in the direction that you're moving, but try and push as hard as you can in the opposite direction. Now watch this carefully. There, pushing and realigning. There. Now similar drill. This time he's just going to take 1 step and back. Resistance goes across his waist, and now he's getting into a bit more sport-specific movement. And this is again a key movement where again you see him pushing down with the right leg, really pushing hard into the ground, and then moving that foot across, where that's going to be a very key position in many sports. But in badminton, they will always do their front lunging with their dominant leg, no matter which side they move. And this is going to be a very key position where they're going to quickly turn around, get the shuttle, hit the shuttle back, and then realign and come to the center. So extending from there, getting that foot across, absorbing the force on the opposite side, and then coming back to the center. There, watch, absorb the force and back to the center. Again, we'll go through each of this running technique drills. So I pretty much explain what a lateral knee drive. Again, it's very important that the force is going down and on the outside, and then he's trying to shift the body weight into this. It should feel like the athlete is trying to push into the wall as hard as he can, but he's generating the force through his legs. This is the other drill we spoke about, how he would drive into out with the outside leg to realign the position, keeping that head position steady, using the arm, keeping them relaxed. Again, keeping a low center of gravity, that's going to be a very key. And if he's standing too upright, he's not going to be very efficient in his movement. And this was the other movement that we spoke about. With the lateral shuffles, there will be much more options up here in terms of executing the movement. Again, the coaching mechanics would be important. When he's doing that foot crossover, is he getting into that nice stable lunge position up here? Is that hand reaching out? Is he still able to keep a nice good trunk position, being stable, getting that back knee nice and low? So that positioning would be important. Posture and position would be important on this one. Thanks, guys. I'm pretty much done. If you guys have any question, I've just put my email at the start. Send me an email, send me your questions, and I'll try and get back as soon as possible. Wish you all the very best. Thank you.
Thank you, Amit. All right. Okay, wake up. Question session. All right. Now, once I ask this question, raise your hand, introduce yourself, and answer. Okay. The ideal zone of running for long distance runner and sprinter. Raise your hand. Okay, ma'am. Please introduce yourself and answer the question.
Hi, I'm Parna Ganesh.
Morning.
It's zone 2
For
long distance,
okay,
and 5 for sprinters.
Can you explain the zones, please?
I'm not sure I can do that well, but I thought that we should. It was about the heart rate.
Correct.
I may not be technically there with the numbers, but 2 is ideal so that we don't burn ourselves too much.
Exactly.
And 5 is to get your heart
Perfect.
rate
So
up.
zone 2 is using 60 to 70% of your maximum heart rate, and zone 5 is maximum, using the maximum heart rate. Okay.
Yeah.
Thank you very much. You can hand over the
Thank you.
prize, please. Thank you. Okay, we go to the next presentation. Dr. Santosh.
I'll help to catch up some time. So running injuries are common. So going through that, you might have knee pain around the knee in so many of the conditions. It can be in front of the knee, it can be outer side of the knee, inner side of the knee, or in the shin, or it could be just behind the shin, or it can be in the muscle. So you don't need to know the details, but the reasons might be different. As you can see here, if it's in the outer side of the knee, it's going to be your IT band syndrome, which is a common thing which happens in runners. The IT band is the structure which from the hip down to the knee, it crosses the knee. Because of repeated friction on the knee, you might have this syndrome. For this, you need to keep stretching your IT band, so don't forget to stretch that. Apart from that, if there is, the pain might be in the bone, in the muscle, deep muscle, or the superficial muscle. If it's in the back of the muscle, it might be cramps. If it's, it can be a muscle tear, if it's superficial muscle, which is painful. If it's just deeper, it might be compartment syndrome, which is a runner's injury. If it's just next to the bone, it could be shin splints, or if it's on the bone, it could be stress fractures. So you should be aware of these. So seek advice if you have pain in the bone or pretty close to the bone, if it's pretty painful and not able to run after that. So how to deal with it, how to prevent this, we'll see with Dibyana. You can stay there and speak from there, it's okay. I'll play the sides for you.
Hello. Good morning, everyone. I'm Divya Prakashkar, sports physiotherapist. Hello. Am I audible to everyone? Hello. Yeah. So I'm going to focus on the prevention part of the runner's knee. That's a condition that happens during running. So it actually affects the cartilages and and tendons of the runner's knee. Then we can refer this quote that intellectuals solve problems, but geniuses prevent them. Actually, after problem, we are doing the solution of the problem, but we can prevent it happening itself. So here is the video of Mr. Harman running. So running is important for everyone. So that's why, next, please. So here is the principle of injury prevention. That's the overall principle. It can be used in every sports injuries. So first of all, warm up. As we have already gone through the warm up. So next, stretching, then taping and bracing, then protective equipments and suitable equipments, then appropriate surface, appropriate training. So here's the warm up exercises. So from Sports Science India, we have Academy of Sprinters. So here the students are training under the Sprinter Academy. So they are going through warm-up techniques, warm-up exercises. Then next. So here is another video of the students doing the dynamic stretchings. Then here is my video. I'm doing calf stretch. Then this is ham stretching. So then in the recovery method, we can use foam rolling and MFR, myofascial release. Then icing is also effective to prevent the injury. Then the taping. You can refer this video that I am doing the taping of a marathon runner. So I put the leg in the 45-degree angle. Then I did 15 to 20% of stretching of the kinesio tape. Then put all around the knee. Then after that, I put the anchor on the patellar tendon to deload the patellar tendon and deload the quadricep muscles as well. So then talking about appropriate surface. So surfaces can vary during running. It's again Mr. Herman running on tracks, and this is on the terrain. So according to surface also, the injury can happen. So this is the new concept nowadays everyone is following, the minimalist running, minimalist shoes and barefoot running. So it said that in barefoot running, it can reduce peak patellofemoral joint loads and slightly compared with conventional footwears. Then foot orthoses. Foot orthoses are actually, it's not helps in the short term, it can help in the long term. If we use the orthosis for long run, it can help to prevent the running injuries. Then it's an overall study that it it says that every prevention methods can used in the long run. It doesn't help in the short term. We cannot expect that we are doing now and we are getting results now only. So it's always followed for long run. If we want to prevent an injury, we have to have patience. We have to do the things slowly and take time to prevent these injuries. Thank you.
Thank you, Divya. Oh. Nikhil, you want to speak through that or just play that?
Hello.
Hello. Yeah. Okay, so as the previous speakers have mentioned about running surfaces, about the biomechanics, about various angles of pronation, stresses on the ankle, we also saw force plate data on running with shoes, running without shoes, where the amount of cushioning of the shoe really helps reduce the amount of force that you actually have to tolerate. Shoes become a very, very important part. Okay, so there are phases in which the shoes have come out, right? So initially, this is about 20, 25 years ago, people came out with the concepts that, okay, you need a good cushioning shoe, and people started with giving very good cushioning. And there were a couple of pointers that you had to look at before you decided what shoe to buy. So the number one pointer was, of course, the length. Now you can't decide that if you're only doing online shopping. So I would highly recommend that you actually go to the shop and try the shoe on before you decide to buy it, okay? Because the length has to be good. A sneaky way of checking the length is the length of your foot is the same distance as between your wrist and your elbow. Okay, don't believe me? Try it out. The same distance between your wrist and elbow is the length of your foot. So that's a sneaky way of figuring it out, but I would still suggest go to the shop, wear the shoe, and make sure that the length of the shoe is okay. The second thing you had to look at was the size of the toe box. Now there are people with narrowish feet, there are people with broad feet, there are people with really broad feet. And again, to make out how much room your toes have online is quite difficult. Go to the shop, wear the shoe, done. A few years later, people came up with the concepts of that you're built for running. So you should go for minimalist shoes, you should go for low heel drops. So those are the different kinds of heel drops you get. So 0 millimeter is absolutely no heel drop at all. The foot is absolutely flat, a bit like flip-flops. And you go all the way up to 12 millimeters, wherein the heel is slightly higher than the toes by about 1.2 centimeters or half an inch. So those are the basic strategies that you can use. I'll come to how you decide which one works for you. A simple fact that I've noticed in my practice is a lot of Indians, about 85% of us, don't really have any dorsiflexion. The ankles don't actually move up. And in a lot of cases, what's happening is your midfoot is compensating. So your midfoot tends to move a bit more, and it compensates for the ankle. So if I was to just show you quickly, if your ankle is not dorsiflexing, then your midfoot has to collapse and go over, right? If your ankle just stops there, your midfoot collapses and you go over. And having a shoe with a heel drop, half an inch of heel drop, will compensate for the lack of dorsiflexion, because now my foot doesn't land like this, it lands like this, and now I have enough dorsiflexion in order to make sure that I run properly. So that was the second thing that came up with regards to shoes. The third thing that came up with is, and this was more from the shoe companies rather than scientists, is that your pronation matters. Whether you're someone with a foot that supinates or you're someone with a foot that pronates or overpronates. So what they did was they came up with shoes that target this portion. But what I just showed you is a lot of us Indians end up with pronation to compensate for a stiff ankle. Next, please. Yeah. So came up with pronation. The midfoot sort of compensates for the stiff ankle. And therefore, even after they came up with shoes specific for people with pronating feet, people with supinating feet, people with neutral feet, the number of running injuries didn't vanish. So the next they came up with the concept that, go for minimalistic footwear, your feet are used to running. A lot of people transitioned from short running to bare feet running. And it did work for some people, didn't work for some people. And the reason it didn't work for some people is time. Okay? If you want to go from running with shoes to running without shoes, everything from your muscles, your tendons, your ligaments, your joint capsules, your bone strength, everything has to change. Your running pattern has to change. And if you give enough time, 12 to 18 months, you can transition from short running to bare feet running. If you're not able to give that much time, if you want to remove your shoes and run at the same speed on the same surface the next day, well, you've come to the right place. So that is what happens. Can you go back 1 second? Yeah. Next. Yeah. So after going through 25 years where first you started with your shoes need cushioning, to you need to find a shoe which fits whether you're pronating or supinating, to you find a shoe which gives you minimum support to allow your feet to do the major job. The final recommendation today is what it used to be 25 years ago. Go to the shop, try the shoe. If it's comfortable, it fits you. Thank you.
Thank you, sir. One last question to the audience. Which sport does these shoes belong to? Raise your hand and answer. All three, you have to answer all three. Raise your hand and answer. Okay, we have one here. You can come forward, sir. You can come to the mic, introduce yourself, and please answer.
My name is Krishna Kumar. The first one on the right extreme is used for football.
Wrong.
Okay. The center one is for long distance running.
Okay.
The other one is for walking, jogging.
No.
Okay.
Wrong answer.
Sorry.
Anybody? Yes? Okay, come on. Come forward. Come to the mic. Time is precious. Introduce yourself.
I'm Shakti.
Okay. Solunga Shakti.
That one is for cricket.
Which one?
Last one.
Last one is for cricket. Yes, correct.
Center one for
long distance running.
Basketball.
Correct. Very good. Very good. You can give away the T-shirt.
So for the last question, sir, Ratan sir was our fastest man of the country. So from your words, please enlighten us about what tips for sprinters.
Very good afternoon to one and all. I'm a little advanced. I'm a sprinter. Thank you. Thank you so much, Ortho-One, for giving me this privileged honor and to give me an opportunity to share my experiences. Fantastic. It's a mind-blowing, enriching sessions with all legends and experts on the dais, off the dais. I am really happy to share my expertise. We saw the biomechanics involved, all the experts sharing it. So let me start with the basics again, once again, rewinding it. I'm going to tell about interesting facts about Usain Bolt and me, both of us, how it is. Because Usain Bolt is the fastest man in the world, and I was the fastest man in the country and South Asia's fastest man. We all know muscles don't work individually. It works in pairs, okay? Agonist and antagonist. Again, it vice versa. So in sprinting, we have 5 phases. The first phase is driving phase, the drive phase. The second phase is acceleration phase. The third phase is maximum velocity. And the fourth phase is maintenance phase. And the fifth phase is deceleration phase. So in the in each and every phase, the biomechanics differs. The foot placement, your center of mass, everything varies. Total drastic changes from each phase to each phase. The first 10 meters from the blocks is going to be the drive phase, and the first 30 meters is going to be your acceleration phase, and the 40 to 60 meters is going to be your maximum velocity phase, and your maintenance phase is going to be another 10 meters or 20 meters extra, and then the deceleration phase starts. So consolidate the muscles which they spoke about. There are many muscles which works in the sprinting, but the major muscles I would like to highlight the significance of sprinting is 9 muscles. The 4 hip flexors, the 3 knee flexors, and the 2 ankle flexors. Only these 9 muscles are mostly involved in sprinting, in agonist and antagonist. The flexors and extensions cooperate equally, and by nature, physiologically, the whole body, the anatomy of the body and the physiology of the body, both are imbalanced by nature. So one side of the organ is bigger or shorter, one leg is longer or one leg is shorter. So when it comes to the topic of this symposium, athlete knee, I would like to specifically focus on knee, how the symmetrical knees and asymmetrical knees involves in sprinting. So to highlight this, I would like to tell something very interesting. If you won't believe that researchers have found that Usain Bolt has got the problem of scoliosis. I hope you all know what is scoliosis. Okay, they have a curved spine in the back, so the gait is asymmetrical. The gait of Usain Bolt is asymmetrical. So when the gait is asymmetrical, there is an imbalance in your hip. When there is an imbalance in the hip, automatically his right side is shorter. When the right side of the individual is shorter, the left side of the body takes longer time. The ground contact is more. So, but fortunately, the interesting factor is that the Usain Bolt's knees are symmetrical. The hip is asymmetrical, but the knees are symmetrical. So the combination of this has the secret of the speed. And when you see Usain Bolt's 100 meters running, that is one reason that the 100 meters runners, the straight runners with the symmetrical knees, researchers have established evidences that straight runners with the symmetrical knees are faster. Whereas the comparative timings of Usain Bolt in 100 meters and 200 meters with 9.58 seconds in 100 meters is, when comparative to the 200 meters, is slower. When you double the 100 meters, it is 19.16. The world record of 200 meters is 19.19 seconds by Usain Bolt. When the acceleration speed is there, it should be much below than the 19 seconds. That is where the asymmetrical and symmetrical knees plays a major role. And when you see Usain Bolt's video running analysis in the straight running, his foot is placed supination. When you see you please replay it, you go at home, watch the video of Usain Bolt straight running. His foot is placed at top speed, the foot is placed on supination's foot. When I was running, I feel my experience is that my foot is neutral. It's not pronation or supination. So that is the interesting fact where the speed is involved and matters in sprinting. And in sprinting, most of that, the ball of the toe rolls. We all saw that different kinds of placement of the foot. In sprinting, it is only the ball of the foot. If the ball of the foot is very active, the dorsiflexion and the plantar flexion is active, then the speed is much faster. So similarly, the knee symmetrical plays a major role, though the gait of the body is asymmetrical. So it is the balance, and as part of the training, it is important for the coach and the biomechanist to find an alternate solution for the imbalance in the asymmetrical of the hip and the knee. That is why Usain Bolt used to do a lot of backward running in the curve. So that is interesting to see how he can become faster in the curve in the 200 meters. That is why that is how he overcome a lot of pain, back injuries and strain in the spinal cord, especially in the lumbar vertebrae. So that is, with these interesting facts, I would like to also add one more point on the concentric and the eccentric muscles of the knee extension and knee flexors and the ankle flexors. If it is proportionately with the equal ratio, because usually the quadriceps has, for example, 3:2 ratio. Like the hamstring works with the 2 ratio and the quadriceps works with the 3 ratio. So by nature it is 4 muscles and 3 muscles. When the hamstring is strengthened and intensified in the training, so it cooperates with the quadriceps. So generally hamstring muscles are injured in the middle part of the hamstring or in the origin point of the hamstring. So the overextension or the overstriding of the hamstring plays a major issue in sprinting. So when it is overstride, then automatically your hamstring is trained more. And especially in my experience, I feel that my center of mass were much more below the foot placement. When the center of mass was below the foot placement and your knee extension or your ankle hip flexor is more extended, then you have an all possibility for an hamstring injury. When the hip gate and your pelvic is pushed forward, then automatically your extension is controlled and your stride length is also controlled with the bounce, your vertical velocity and your horizontal velocity. So this is a very important aspect on the sprinting I wanted to share with you. And on the starting blocks, and I'm proud that my student Indian is there here to be presented on the starting blocks. On the set position where the starting block is full of completely isometric exercises. So once you strengthen your isometric conditioning, then automatically your starting will be perfect. And in the set position, the rear leg, the heel has to be pressed with the blocks so that you don't lose time in the reflex of when reacting to the gun start. So that is one point I wanted to add it in the starting blocks. And the hamstring, I would like to add one more point in hamstring injuries, which I had experienced during my days. The hamstring injuries are very important for sprinters to be protected. It has to be overcome by training, where the curling exercises of the hamstring, where when the fulcrum is shifted, when you curl, when you flex the knee backward for the hamstring, beyond the point of knee flexion, exactly 90 degrees, then it goes, then the hamstring is loosened there. At that point, we have to ensure that the strength is developed at the origin point and at the insertion point. So that is what we have experienced. In fact, all my world accolades, my performances is attributed to Dr. Kannan Pugalendi, who is sitting here. But for him, I wouldn't have performed in world class. And he had totally tormented my hamstring and ensured that we didn't have any hamstring injuries further in my sprinting history. So with this, I leave the stage open for any questions related to this. And thank you so much for this opportunity again.
Thank you all. With this, we come to the end of the running analysis. And I thank the moderators and speakers for enriching this stage. You can take on to the chairs, sir. Thank you. Thank you very much. I'll give it over to Vinci for the next session. Thank you.